Good. We also thank the organizers for the opportunity to present a large amount of the work we have been doing these past years at the Text Mining Unit of the Barcelona Supercomputing Center. I'll be introducing this talk, and afterwards Antonio will continue. The title of our talk is the use of natural language processing and text mining for health, nutrition, and food safety. Most of the resources developed are within the framework of the Plan for the Advancement of Language Technology, which is mainly funded by the Spanish government. And we have to say that I don't know, and I'm quite happy to talk after Eulalia and Enrique because they have introduced many aspects that we would talk about too. I don't know with the data that Enrique has presented if they work in the English language, because most of our work, we work in English as well, but it's in Spanish, and we have worked also something a bit in Catalan. So I will talk about the motivation and background, why NLP, why food, why health, why now. And then I will introduce food and nutrition related entities that we have been working in different corpora. Antonio will continue with the LivingNER corpus, which is our species corpus, and the fauna corpus, which is the food and nutrition abstracts, a multilingual corpus, and he will also deliver the conclusions. So why food? This is not very difficult for us because, as Enrique has pointed out, food affects all aspects of human life. Being a pediatrician, I know that babies that breastfeed have an early advantage in terms of immunity. They have less allergies. They have a healthier gut for life, probably. So our group focuses on human health. So we are not interested only in the strictly medical things, but on all aspects that affect human health. And of course, food is a very important one. The society is much more aware of the food that has lots of pollutants or lots of chemicals and want better food, and food that is more sustainable also for the planet within the concept of One Health, in which we understand that humans are not the only ones in the planet. We interact with animals and the earth in terms of bacteria that we share. And then COVID-19, the interest of COVID-19 is that it has accentuated all the inequalities regarding food accessibility in terms of people that have lost jobs, etc., have less income to eat better and have changed their diets, for instance. Another aspect why NLP and food and health now is that the advances in NLP and artificial intelligence mean that we can process lots of data from many sources now. And this is very interesting, as we will see. I think Enrique and Eulalia have pointed already out many of the data sources that we have used and that we will be using. And mostly because all the information that, for instance, regulatory bodies, veterinary health, the food industry, etc., puts out there can only be exploited using natural language processing techniques. We believe that it's very important to include all these data sources to get a comprehensive view of what food and health mean for us. So I'm a doctor, and obviously I'm very interested in diseases and health. So we see that when we process food data, we will know more about nutrition, which of course is as essential as oxygen for life. Nutrition impacts all diseases. If you are obese, you are more at risk of cancer, of cardiovascular diseases. It tells us a lot about lifestyle and the risks of our lifestyle. For instance, if we are vegans, we have to take into account that certain amino acids, certain vitamins are not in vegan food, so we have to take supplements. Of course, we have the eating disorders, which are mainly recognized as mental disorders, but have to do with food, of course. We have the different forms of malnutrition. We have the malnutrition of people that don't have access to food. And we have the pandemic, the obesity pandemic, which affects most countries in the world. And we have specific circumstances. We know that people with dementia, with alcoholism, people that have been neglected, need supplements, need more careful nutrition. However, we will focus especially on food safety because we work a lot with case reports, with electronic health records, and we have expertise in this domain. And here we have two very recent pieces of news. One is 2019 and of an outbreak of Salmonella in a school. The other is just from this summer. You might all remember that some ice creams were contaminated with ethylene oxide, and which is very toxic. So food safety regards infections, so the presence of mainly bacteria, but viruses as well, and fungus, so microbes in food. We have allergies. We know that people with peanut allergy, for instance, if they eat something that contains peanut, they might die. And the intoxication, for instance, this intoxication with the ice cream this summer. And here, we talk a bit about the data sources. Our group has extensively worked with biomedical literature, clinical case reports, which are clinical cases that are published. The electronic health records is what the clinicians have in hospitals and in primary care, so what the doctor and nurses write about the patient. And of course, we have there is also social media, as Eulalia has pointed out, and we have also worked in social media. So apart from these sources, for food and nutrition, we believe other sources that are important are news, and we see here again news talking about outbreaks in food diaries, and blogs and forums of patients that comment problems they have with certain foods, etc. Again, we like using lots of data sources because we believe, while scientific literature is for me practically the most important, this with electronic health records, but we have to take into account very much and more what the public has to say, what people think about if we want to implement effective measures to improve human health. So we have worked with many entities that can relate to food and health. All these entities that you see, this corpus that you see in pink, are corpus that we have prepared. Not all of them are available, I think. You can ask about this later. All these corpus are manually annotated, and we have for them they are gold standard data sets, and they have good quality measurements. So first we have symptoms. For instance, if a patient vomits, has diarrhea, we know gastroenteritis, probably it's a bacteria, virus. We have medicines, we have medical procedures. Medical procedures can be an injection, a vaccine, can be an X-ray, etc. The diseases themselves, for example, gastroenteritis by Salmonella would be a mention of an infection, of a disease. Occupations will be here more related to food manipulation, food production. And finally, and very importantly, our species corpus, which contains all living things, be it a cow or a human, or viruses, bacteria, and fungi, and plants. So here, when you see these short sentences in Spanish, which have which are annotated and have the translation here in English in salmon color. These are screenshots of corpus that we have annotated with the BRAD annotation tool. And we have put them as examples so that you can understand better what we have been doing. So symptoms are very important. Here we see a person that goes to the emergency room because that person has epigastric pain that has suddenly started and has nausea and dizziness. So why are symptoms important in food and health and food safety? Because it might be a method to detect an early outbreak, for instance. If we put surveillance systems in, for example, in hospitals, in surgeries, in social media, they might detect an increase in people that feel nauseous or that have diarrhea or that have eaten a type of meat or ice cream or whatever it is. And this is a man feeling very sick. Okay. And now medicines. This is a person that takes metoclopramide, which is an antiemetic. Antiemetic means that it prevents you from vomiting. Erythromycin is an antibiotic that is used, for instance, to treat Campylobacter, which is a food-borne pathogen. So medicines are important because they can be supplements of food. For instance, if a person has a deficit in calcium, in iron, in vitamins, these will be medicines. Also because medicines, like we have seen with this antibiotic, can treat food-borne pathogens. Medical procedures, it's a bit like medicine, but more advanced. We have medical procedures that to ensure adequate nutrition. For instance, this is a person that cannot eat normally through the mouth, so he gets a nasogastric tube and is given what we call enteral nutrition, which would be the name of a procedure which we would annotate as such. In the example, we have a study of parasites in stool, which mean a person looks at the stools after treating them under the microscope to see that if they have parasites in a stool that are causing the symptoms of that person. So these are also very important for food safety and food-related health problems. Diseases, obviously, there are all these food-related disorders, mainly the food-borne pathogens like Salmonella, E. coli, Campylobacter, allergies to food, which can cause extreme reactions like peanut allergy, which can cause the throat to close completely because it's inflame and the person to die, or intolerances, which makes people have diarrheas, lose weight, or in the case of children, not grow properly. The toxins, we have talked about the ice creams this summer. Diseases can be related also to occupational health. This could mean diseases that a person has because of their specific work. The example here mentions prion disease, which some of you are very young, but the rest that are not that young could remember in the 90s there was an outbreak or epidemic of prion disease in the UK through eating cow's meat. And occupations, we have seen already, Martin has shown in the introduction some of them. So some occupations would be related to food production, like the cattle breeder, the farmer. Others would be food manipulators in a way, like butchers, fishmongers. The other would be waiters, people that serve food. All these people are at risk of getting some diseases and also of transmitting diseases related to food. And finally, we have the species corpus, which Antonio will present in a second. And this contains lots of entities related to food and food safety, because it detects, as we have said, the pathogens, all microbes, being viruses, fungus, or bacteria. It detects all plants and animals, and it detects any host, be it an animal or humans. So the examples, we have a case with where a person drinks unpasteurized goat's milk and gets brucellosis, which is quite a nasty disease. And in the other, we have a line which tells that somebody was going in and getting mushrooms and was not. Anyway, so I think I will finish here. I don't know if I have taken more than my time, and Antonio will continue. Thank you.
Thank you, Eulalia. I will continue, so please let me start sharing. So as Eulalia just mentioned, the entity species, the information related to species can be very relevant for food and health. So extracting that information can be one of the first steps to extracting and structuring the information related to food and health in documents. We may see that the species information, the species information in medical documents can be related to food and drug interactions, to food-borne infection, food-borne intoxications, and to many other applications. Why? Because the species contain not only mentions of plants or mentions of animals that we are eating, but also mentions of microorganisms causing some of these diseases. Since extracting species information from text, from medical text, is very relevant, there has been previous efforts, some of them very well known, in how to extract that information from unstructured text and then put it in a more standardized and structured format. This involves two steps. First of all, you need to detect actually the species mentioned in the text. And for example, we have the Linnaeus tool and many others. But then after you have detected that information, you have to normalize it. You have to map it to a standard ontology or something similar, resource similar. And for instance, we have the NCBI taxonomy. All those previous efforts, which were very relevant, are mainly, most of the time, focused on English documents, and they are not tailored to clinical documents, and of course, they are not tailored to food safety. So to overcome some of the limitation, we have created this LivingNER corpus, which is a corpus of Spanish clinical case reports in which we have species manually extracted and normalized to NCBI taxonomy. So for example, I give you here some lines in which the status of a patient is being reported, that is a clinical case, which is a type of literature document very similar to actual medical records and that talk about what is happening to a patient. And we see here that some entities such as woman, fishmonger, anisakis, and parasites are extracted and also normalized to a standard terminology so that all the information can be easily structured. The characteristics of this corpus is the first one that it is in Spanish, so it solves part of the let's say limitations of previous approaches. Not really limitations because they were not thinking of Spanish. Second, the corpus contains clinical documents, in this case, clinical case reports, and it is tailored for information structuring. Why? Because we have extracted the entities and also normalized them to a standard terminology. Then the corpus selection, when we selected which documents do we want to include in this corpus, was very transversal. We did a manual selection of the documents, including many medical specialties, which I list here. No need to read all of them, but I will give you a couple of examples. So, for instance, we have a neurology patient with active thromboencephalitis caused by listeria, or we have a patient from the oncology service that refers regular intakes of wild watercress. And as I said, we have such examples from many other medical specialties. For example, allergology. We have a patient that was recommended to follow a tomato, peanut, and peach-free diet because he had some allergies or food intolerances. And as I said, many other examples. From the quality point of view, we created strict annotation guidelines. This is a around 20 pages long document in which what should be extracted and how it should be normalized is described. So these annotation guidelines describe the protocol of extraction and normalization of the data, of the species data. And it defines what is a species, and also it defines which mentions of human we are including here. So every mention of, for example, mother or children, adolescent, that is also a species. It also describes which kind of pathogens we are including, like nosocomial pathogens, etc. This document will also be released in addition to the corpus because it's very key to understand what has been annotated. Finally, the corpus is quite large. It has 2,000 documents with more than 30,000 manual annotations, and we follow some iterative strategy to enhance the annotation because we did some automatic annotation, then those automatic annotation were corrected, validated, and complemented with manual work, and this helped us to retrain our own system that is able to transform unstructured text, as we see here in this example, into text with annotation. We are able with this system to extract the species information, and that can be very useful. That can be very useful for many of the practical scenarios we described previously, right? Like food-borne infection. This system is capable of detecting in this text that Salmonella nontyphi is causing some bacteremia and from a probable digestive origin, or that this girl is in this text, it says that a girl has taken a yogurt with almonds and peanuts. We can extract this information of girl, almond, and peanuts. And we could see examples of food intolerance, microorganism microbiome, and I will forward to all of the interested ones these examples if you want after the talk. So in addition to this LivingNER corpus, we are presenting here a second resource which is already public. You can go to this Zenodo link, which is the Food and Nutrition Abstracts Multilingual corpus. It is a multilingual corpus of clinical case abstracts related to health, food and nutrition with automatic entity annotations. And it is key because it is quite large. It has been done through manual selection of the indexed terms, and because it contains annotation from many different entities, which we have Eulalia has previously characterized of importance, such as not only species but also disease or medical procedure. We took it from, we selected the documents from 3 databases, LILACS and IBEX, with that contains Spanish documents, in this case Spanish clinical case abstracts, and PubMed, which has English clinical case abstracts. So selecting the type of document as clinical case abstract give us some makes us being sure that the documents are of health scope, and then we manually selected 450 mesh terms to further filter this document set and obtain only documents of the food and nutrition domain. The English documents were then machine translated with a medical machine translation engine to Spanish, and all the Spanish documents were automatically annotated with our deep learning systems. And I leave you here a snippet of the corpus, and it will be public, and it is already public in this URL that I will paste in the chat after the talk has finished. It has some characteristics that I will briefly explain. First, it is multilingual because it contains documents in English and Spanish. And once again, we are using clinical case abstracts in this case because they contain patient-related content. So we have food and health information and patient-related. So it is close to the medical records, or at least closer than what regular literature would be. It is transversal because we have selected many mesh terms to index those documents. So we are sure that there is a very rich content in the document, in the corpus selection. It is really, really large. We have more than 200,000 automatic entity mentions in both in Spanish, in English, and also in Spanish after it has been machine translated from English. Finally, from the quality point of view, we did the annotation with advanced deep learning models, and we did a manual selection of all the mesh terms so that the corpus selection is of very high quality. So going into the end of this talk, recapping from what Eulalia said, NLP is the only method that allows us to extract actionable information from all these data sources, doctor's reports, social media, medical literature, etc. And due to that, it could be used, for example, for disease outbreak of food-borne diseases. But also, if we are able to combine the information extract by NLP with all the health-related information in wearables or app, we could go towards more personalized diets depending on the need of the patient or the person interested, like weight loss, specific nutrients, avoidance of allergens, etc. Importantly, all this data on human food and pathogens can be integrated with data from, could be integrated with data from veterinary health and earth microbiome to really understand the mechanisms that promote and hinder a fruitful and symbiotic relationship between humans and the planet, and we will get this concept of One Health. And to end as outlook, there are still difficulties to overcome, even in the fields in which we have already released these resources, or we are planning to, like the species domain, because as Martin said at the very beginning, all the food-related information and also the species-related information is not very standardized. There are many ambiguities, language variants, even in the different Spanish regions and different regions that speak Spanish from, for example, Mexico or Argentina or the north of Spain. So as future project, we are preparing a manual validation of these fauna annotations, and we will create a subset of the fauna corpus tailored to food safety. In addition, the species, the LivingNER corpus, which was the first resource I presented, will be released in a community competition to promote the state of the art in the species competition in Spanish related to health. And of course, all these resources need to be adapted to other data types, such as social media, to complement what the talk from Eulalia. And of course, we have many other projects, and we are open for collaborations with all of you. If you have an interesting use case, I want to thank you, the conference organizers, and also the IberHeLT organizers, the speakers, and the plan for funding. I leave here again the fauna corpus citation, and also our links and the people at my group in the BSC Text Mining Unit. So thank you very much.